to the ureter.
Okay. And from what you are saying, it looks like you said, the way God made the man, it looks like this prostate is an important part of the man's physiology. Like in terms of, when you quoted the Bible earlier and you said the essence of creation is procreation. So it looks like without the prostate, procreation may not possibly happen.
No, really. No, without the prostate, the procreation will still happen because it's two different, it's basically two different organs.
Okay.
Okay? The seminal fluid passes through the urethra. Urethra.
Yeah, correct. But seminal fluid.
Yeah, but the prostate does its own work. Now, the work is this. Let's say I'm making love with my wife, and my wife's vagina is maybe as normal, acidic. Before your semen comes out, there are this fluid that tastes salty. It's not the sperm. It's a fluid that neutralizes that vagina wall.
So without that neutralization, that vagina may not be able to welcome the sperm.
Exactly.
Yeah, because
so
the sperm will be hot. The semen, or the spermatozoa, as we call it, the wall of that vagina, because it's acidic, will be hostile to that semen that is coming.
It means it's been
meaning that it will kill the semen if that alkaline nature of the prostate didn't come first to neutralize the wall.
Can I say something here?
Yeah.
I know. It's just a way to.
Yeah, because I need this clarification, because it looks like the woman's body is hostile to the man's body.
Not necessarily hostile. It's just that that's the way the woman's body is designed. You see, the woman's vagina and all the walls of the uterus, they actually have that acidic wall. Is to kill bacteria or any other organism that can actually come in there.
Yeah.
You understand? And even say if people, like those people where they give head, sorry, I have to say that, you understand what I mean. If you test that, you see that sour test. That sour test there is a sign of it being acidic. If the people who are scientists who actually if they put what they call a pH meter there, it will range between 1 to 6. Then you need to neutralize it to what they call 7. That's the neutral point. The the prostate gland is release the prostate fluid. There's alkaline nature. When they make alkaline nature, it has to balance and neutralize that thing to bring it to a neutral level. If it doesn't go to that neutral level, the sperm cell inside the semen might be killed off due to the acidic environment of the vaginal wall. So probably those things it's just the way it is. It's nature. You understand? Trying to preserve. That acidicness is not against the man. It's to protect the woman from anything that will actually infect her. But because the human physiology is designed in such a way by they think that, to procreate life, there has to be a balance. The man needs to actually balance his own by releasing an alkali prostate fluid to actually neutralize the acidic nature. It doesn't change anything. So that particular environment, everything happens smoothly. So that's just the way I want to.
Yeah, it's good. It's good. Sure. We have these explanations. It means we should know that when we talk about prostate, it's not all about the problems or the medical problems that comes maybe later in life. So prostate does more of it's more advantageous to family life, to procreation, than the way the society see the problems that comes when later on in life. And I would want Doc to tell us more about like those issues that occur with the prostate.
Okay. We have 3 stages of issues that may occur with prostate. The first stage is the prostatitis. That is the infection stage. As at that time, it's not cancerous. It is not hyperplasia. Just that there is an infection. It's bacterial infection. When there is any bacterial infection that passes through the prostate, the bacteria now incriminated the urinary tract system. At that stage, what will happen is that the bladder will start overworking itself, because there is an evender to the bladder that has triggered the prostate because of the infection to trigger the bladder to start functioning more than necessary. That is where you see a man start peeing so many times, maybe at night. And this will occur from the age of 40, 45, 50 age. Now, when you start peeing to that extent, you are continuously peeing. At the time, the pee might not even finish. You might pee now, go back to bed, and still feel that I have not peed. What's wrong with me? Some people might mistaken that maybe it's diabetes, but not knowing that it is infection, because there is a bacterial infection. So at that stage, it has disturbed the prostate wall. It has disturbed the bladder. Anything that affects the prostate will affect the bladder. So at the first stage of the disorder is what we call prostatitis, meaning that there is a new body. And the body is trying to give you a signal to your bladder by telling you that this new bacteria that have just entered this house now
causes inflammation.
It's causing inflammation to you.
And it's very painful as well.
What is you now start having a result of reflux of urine through the urethra, and when the bladder seems to be infected.
Doc, before you go to the other aspects of prostate issues, there is something based on what you said. There is something we may need to clarify here. There are, as adults, most times people experience UTI. So, because we are talking about passing urine here, could to clear the mind of people when they have UTI, that is not prostate. Is there any relationship?
UTI is when you get UTI, there's two or three stages, types of UTI. Sexual transmitted disease is a UTI.
Okay.
Urinary tract infection, like E. coli, Staphylococcus, Streptococcus, those ones are normal flora in your body. But when there is inflammation, when there is a disturbance, it's now, instead of normal flora means symbiotic system.
It now becomes opportunistic infection.
Yeah, they live in you. They're not disturbing you. You are not disturbing them. They feed from you. You feed from them. But when there is an infection, probably through sexual transmitted, probably through probably those that lick wash plates with mouth. And
beware.
And maybe they contacted infection from the woman's side, and it now get down to the body, trigger the your normal flora in the body. So the staphylococcus that is normal in your system, or the strep, or the E. coli, or pseudomonas, all of them will start reagitating. So those ones are different from prostate infection. Okay. Those ones are, it's either sexual transmitted, or that your body, there's a new infection that comes in through any other way. It can come through your normal penile region, not through the prostate, but through the penis. Probably toilet, you are sitting down in your toilet, the toilet is infected, you didn't wash it very well. Your penis touched the wall of the toilet and infected, infection might pass through there, or you have licked plate, and it all brings infection down to your body. Those ones are different from prostate issue.
Good. It's good to clarify this.
So can I ask, you say there's a third UTI, there are three. Is it 2 or 3?
No, I mean stages of infections, not UTI. Okay. You can get UTI through sexual transmitted. You can get UTI through toilet infection. You guys know that men even have candida, but it's majorly on women.
Yeah. Candida because a kind of fungi.
Yeah.
It's a fungal infection. It's good there, some audience, you understand that when we say microbe, we actually refer to bacterial and fungal infection here. UTI itself could be any of them. It could be both fungal, bacteria, and viruses as well. You understand? Mm-hmm. Yeah, even HIV itself and any other is virus. You understand? You could still come through that, but it doesn't really necessarily cause urinary tract infection, but probably is a sexually transmitted disease. But anyone that affects your urinary tract, probably like for instance, Candida albicans, and is on in men, or probably is gonorrhea. Syphilis on its own, you understand, herpes and all the rest, they can actually affect the way you urinate, and probably you feel the infection. Let me just use the very common one, like gonorrhea itself. Should be like it should be gonococcus something thereabouts is the name of the bacteria that causes that. And whenever that bacteria actually gets into, you see that painful sensation you feel while peeing. You understand? That's an example of urinary tract infection.
To help my brother, doctor here.